What if I told you that many women are suffering through hot flashes, mood swings, and sleepless nights, while others are taking treatment they may not even need yet? And here's the real question. When should menopause actually be treated? And when is it better to wait and simply observe your body? Menopause is not a disease. It is a natural stage of life. But for many women, it doesn't feel natural at all. Some women pass through it smoothly, while others feel like their body is completely changing from the inside out. Hot flashes at night, sudden anxiety, dryness, sleep problems, mood changes. And then comes the big confusion. Should I start hormone therapy? Or should I wait it out? Am I overreacting or ignoring something important? In today's video, we will break everything down in simple language: what menopause really is, at what age it starts, common symptoms you should never ignore, when treatment is necessary, when it is better to wait, risks and benefits of hormone therapy, and natural ways to manage symptoms. So stay with me till the end, because this knowledge can completely change how you experience this stage of life. What is menopause? Menopause means the permanent end of menstrual periods. It happens when the ovaries stop producing two important hormones: estrogen, progesterone. A woman is officially in menopause when she has had no periods for 12 continuous months. Before menopause comes a phase called perimenopause. This can start several years earlier, sometimes even in the early 40s. During this time, hormones go up and down like a roller coaster. That is why symptoms can feel unpredictable. According to medical guidelines, menopause usually happens between age 45 to 55, most common age. But early or late menopause can also occur. Common symptoms of menopause. Not every woman has the same symptoms. Some have mild changes, others have severe discomfort. 1. Hot flashes, sudden heat waves in the body, often at night. 2. Night sweats, waking up drenched in sweat. 3. Sleep problems, difficulty falling or staying asleep. 4. Mood changes, irritability, anxiety, sadness, or emotional sensitivity. 5. Brain fog, forgetfulness and difficulty concentrating. 6. Vaginal dryness, discomfort during intimacy. 7. Weight gain, especially around the abdomen. 8. Heart palpitations, feeling like the heart is racing. 9. Bone loss risk. Lower estrogen increases risk of osteoporosis over time. These symptoms happen because estrogen affects many systems in the body, not just reproduction. Why menopause symptoms happen? Think of estrogen like a protective hormone for the body. It helps with brain function, bone strength, skin health, heart health, mood stability. When estrogen drops, body temperature regulation becomes unstable and causes hot flashes. Brain neurotransmitters change and leads to mood swings. Bones lose protection, has weakness risk. Vaginal. Tissues become thinner, causes dryness. That's why menopause is not just a period stopping, it is a whole body transition. When to treat menopause? Menopause is a natural stage of life, not a disease. That means not every woman needs medical treatment. The key idea in modern medicine is, we don't treat menopause itself, we treat symptoms and risks caused by menopause. So the real question becomes, when do symptoms become serious enough to need treatment? And when is it safe to simply wait and manage naturally? Let's break this down clearly and deeply. 1. The golden rule. Treat the impact, not the age. Doctors don't start treatment just because a woman reached a certain age like 45 or 50. Instead, treatment is considered when menopause reduces quality of life, affects daily functioning, causes long-term health risks, becomes emotionally or physically distressing. So two women of the same age may have completely different needs. One may need treatment urgently, the other may need nothing except observation. 2. When symptoms become moderate to severe. The most common reason to treat menopause is symptom severity. A. Hot flashes and night sweats. Treatment is recommended when Hot flashes happen many times per day. Night sweats disturb sleep repeatedly. Sleep deprivation leads to fatigue. Work or daily life is affected. Example: a woman waking up 4 to 5 times every night soaked in sweat. This is not mild anymore. This is treatable. B. Severe sleep disturbance. Sleep problems are one of the strongest indications for treatment. Treat when: cannot fall asleep for hours, frequent waking every night, daytime exhaustion, poor concentration due to lack of sleep. Chronic sleep loss can increase risk of depression, high blood pressure, weight gain, memory problems. So doctors often treat sleep-related menopausal symptoms. Early. C. Mood and mental health symptoms. Menopause can affect brain chemistry. Treatment is needed when there is persistent anxiety, irritability affecting relationships, depression or emotional numbness, loss of motivation, panic-like symptoms. If menopause is triggering significant mental health issues, it is no longer just hormonal change, it becomes a medical condition needing support. 3. When vaginal or urinary symptoms occur. Low estrogen affects genital and urinary tissues. Treatment is strongly considered when a. Vaginal dryness causes pain. Pain during intercourse. Burning sensation. Discomfort even while walking or sitting. B. Recurrent urinary symptoms. Frequent urinary tract infections. Burning urination. Urgency or leakage. These symptoms often do not improve on their own and may worsen over time without treatment. Local estrogen therapy is commonly used here and is very effective. 4. When bone loss risk is high. One silent effect of menopause is loss of bone strength due to reduced estrogen. Treatment is considered when early menopause before age 45 to 40 years. Family history of osteoporosis. Previous fractures. Low bone density on scan. In these cases, hormone therapy or bone protective medication may be recommended, because untreated bone loss can lead to fractures, height loss, chronic pain, disability in older age. 5. When early menopause occurs. This is one of the strongest medical reasons for treatment. Early menopause is before age 40 to 45 year. In these women, hormone levels drop too early. Doctors usually recommend treatment because protects bones, protects heart health, supports brain function, prevents long-term hormone deficiency complications. In early menopause, treatment is often not optional, it is protective medicine. When quality of life is affected. This is the most important modern guideline. Even if symptoms are not dangerous, treatment is considered when life becomes difficult. Examples: cannot focus at work, constant fatigue, social withdrawal, relationship stress, loss of enjoyment in daily life. Medicine today focuses on: is the woman living well? Not just, is she surviving? 7. When hormone therapy is most beneficial. Hormone therapy is usually considered when age is under 60, within 10 years of menopause onset. No major health risks like cancer or clotting disorders. Symptoms are moderate to severe. This is called the timing window principle. During this window, benefits are highest, risks are lowest. This is why doctors avoid starting HERT very late in menopause unless necessary. 8. When non-hormonal treatment is still needed. Even if hormones are not used, treatment may still be needed if severe hot flashes exist, mood symptoms are strong, sleep is disrupted, hormones are contraindicated. Non-hormonal options include certain antidepressants, lifestyle changes, sleep medications, vaginal moisturizers, or local treatments. So no hormones does not mean no treatment. 9. When you can wait. Now the other side is equally important. You can safely wait if symptoms are mild, sleep is normal, mood is stable, daily life is not affected, body is gradually adjusting. In these cases, the body often adapts naturally over time. Symptoms may reduce within months to a few years. Doctors usually recommend monitoring, lifestyle support, reassessment if symptoms worsen. 10. Important warning signs that should never be ignored. Even during menopause, some symptoms need urgent evaluation. Unusual vaginal bleeding after menopause. Severe chest pain or shortness of breath. Sudden severe depression. Rapid, unexplained weight loss. Severe pelvic pain. These are not typical menopause symptoms and need medical attention. Menopause should be treated when symptoms are moderate to severe, sleep is disturbed, mood or mental health is affected, vaginal or urinary symptoms cause discomfort, bone health is at risk, early menopause occurs, quality of life is reduced. When it is better to wait in menopause. Menopause is one of the most misunderstood stages of a woman's life. Because symptoms can be uncomfortable, many women feel they must start treatment immediately. But modern medical guidelines are very clear. Not every woman needs treatment right away. In many cases, waiting with Artsham is actually the safest and best choice. This approach is called watchful waiting or expectant management. It means no immediate medication, careful monitoring of symptoms, lifestyle support, treatment only if needed later. Let's understand in detail when it is better to wait instead of treating menopause immediately. 1. When symptoms are mild and tolerable. The most important reason to wait is simple. The symptoms are not disturbing daily life. Mild symptoms may include occasional hot flashes, slight mood changes, minor sleep disturbances, mild irregular periods during transition, temporary irritability. If a woman can still sleep reasonably well, work normally, maintain relationships, function without distress, then treatment is usually not needed. In many women, these mild symptoms gradually improve as the body adapts to lower hormone levels. 2. When the body is still adjusting naturally. Menopause is not an instant event, it is a slow transition. During perimenopause, hormones fluctuate up and down. Symptoms may come and go. 1 month may feel difficult, another month normal. In this phase, starting treatment too early can sometimes interfere with natural adaptation. So doctors often recommend observe first. Track symptoms. Avoid rushing into hormones unless needed. 3. When sleep is still acceptable. Sleep is one of the main reasons women seek treatment. But if you are sleeping most nights, only occasional disturbance occurs, you feel rested during the day, then it is better to wait. Why? Because mild sleep issues often improve naturally with routine changes. Stress reduction, diet and lifestyle adjustments. Medication is usually reserved for persistent insomnia, not occasional disruption. 4. When quality of life is not significantly affected. This is the core decision point in menopause care. Doctors ask, is this affecting how you live your life? You can wait if you are managing work normally, you are socially active, you are emotionally stable most of the time, symptoms are present but not disabling. Menopause is treated when it becomes a problem, not just a condition. 5. When risks of treatment may outweigh benefits. Hormone therapy HRT is effective but not risk-free. It may not be needed if symptoms are mild. No major distress exists. Natural coping is working. In such cases, starting medication too early may expose a woman to unnecessary risks like blood clots, in some breast tenderness, hormonal side effects, need for long-term monitoring. That's why doctors avoid overtreatment. 6. When lifestyle changes are enough. Many early menopausal symptoms respond well to simple lifestyle measures. If a woman is improving with regular walking or exercise, better sleep routine, reduced caffeine, spicy foods, stress management techniques, balanced diet, then there is no urgent need for medical therapy. Waiting allows time to see if lifestyle alone is enough, if symptoms naturally reduce. 7. When hot flashes are infrequent. Hot flashes are one of the most common symptoms, but not all require treatment. You can wait if hot flashes are mild. They happen occasionally. They do not disturb sleep or work. Treatment is mainly for frequent hot flashes. Severe night sweats, sleep disruption. If not severe, observation is safe. 8. When mood changes are temporary, hormonal changes can cause irritability, mood swings, emotional sensitivity, but in many women, these are short-lived, mild, linked to stress or life events. If mood changes are not persistent or severe depression is present, it is better to wait and observe. However, if depression is severe, treatment should not be delayed. When bone health is still stable. Not all menopausal women immediately lose bone strength. If bone density is normal, no history of fractures, no strong risk factors, then immediate hormone therapy is not required just for prevention. Instead, doctors may recommend calcium, vitamin D, exercise, monitoring with bone scans later. 10. When menopause is early but symptoms are mild. Even in early menopause, treatment decisions depend on symptoms and risks. In some cases, symptoms are mild. No bone loss yet. No severe hormonal imbalance effects. Doctors may still consider short-term observation before starting therapy, but in confirmed early menopause with risks, treatment is often recommended, so this is always individualized. 11. When patient prefers non-medical approach first. Patient preference is very important in modern medicine. Some women prefer natural approaches first, avoiding hormones unless necessary, lifestyle-based management. If symptoms are mild, this approach is completely reasonable. Doctors usually support shared decision-making, starting simple, escalating only if needed. 12. Why waiting is sometimes beneficial. Waiting is not doing nothing. It allows natural hormone adaptation, better understanding of symptom patterns, avoiding unnecessary medication, personalized treatment later if needed. Many women find that symptoms peak for a short time, then gradually reduce over 1 to 3 years. Important when waiting is not safe. Waiting is not recommended if severe hot flashes disrupt sleep, depression or anxiety is significant, vaginal pain or urinary symptoms are present, early menopause is diagnosed, bone loss risk is high. In these cases, delaying treatment may worsen long-term health. It is better to wait in menopause when symptoms are mild, life is not affected, sleep is mostly normal, mood is stable, body is adjusting naturally, lifestyle changes are working, no major health risks are present. Menopause care is not treat or ignore, it is about balance. Sometimes the best medicine is time, sometimes the best medicine is treatment, and often it is a combination of both. The key is, understand your body, track your symptoms, avoid rushing decisions, treat only when truly needed. Hormone therapy HRT is simply explained. Hormone replacement therapy means giving estrogen and sometimes progesterone back to the body. Benefits: reduces hot flashes, improves sleep, helps vaginal dryness, protects bones, improves quality of life. It is considered the most effective treatment for hot flashes and night sweats, but it is not for everyone. Possible risks include blood clots, stroke, in some cases, breast cancer risk lightly increased with long use, gallbladder issues. Risk depends on age, health condition, type of therapy, route. Patches and gels may have lower risk than oral tablets. Who should avoid hormone therapy? Doctors may avoid HERT if there is history of breast cancer, history of blood clots, liver disease, stroke or heart attack history, unexplained vaginal bleed. In such cases, non-hormonal treatments are considered. Natural and lifestyle options. Even if you take medical treatment or not, lifestyle matters a lot. 1. Healthy diet, fruits, vegetables, calcium-rich foods. 2. Exercise, walking, yoga, light strength training. 3. Sleep hygiene, fixed sleep schedule, less screen time at night. 4. Avoid triggers, spicy food, and hot flash, alcohol, smoking. 5. Stress control, deep breathing. Meditation. Relaxation techniques. Biggest mistakes women make: waiting too long in severe symptoms, starting treatment without proper consultation, ignoring bone health, believing nothing can be done, self-medicating hormones. Menopause management must be Personalized, not guessed. Menopause is not the end of health. It is a transition. Some women need treatment early, some women never need it, and many fall somewhere in between. The key is, listen to your body, understand your symptoms, talk to a healthcare provider, make informed decisions, not fear-based ones. If you found this video helpful, make sure to like this video. Subscribe for more health explained in simple language. Comment below, what menopause symptoms do you want explained next? And remember, menopause is not something to fear. It is something to understand. See you in the next video.